What's going on, guys? It's Jeremy, and today we're going to be talking about medical bags for the Minutemen and reviewing the Elite Striker medical bag. So before we get into the breakdown of this bag, I kind of want to talk about where this bag comes from and what its purpose is. So this bag was paid for completely with funds donated by our local Minuteman group. This bag is specific for the group, and its purpose is kind of mixed. It provides a higher level of care to our guys in some sort of environment, but also serves as a way to render care for civilians. So it's a little bit of a mix. You see some guys with really high speed packs, and you see some guys with packs that are really just a bunch of IFAKs crammed into one. I think this is a really good meet in the middle and provides a lot of different levels of care. We decided we wanted something like this because we wanted to expand our ability to not only provide medical attention to ourselves, but also aid the community in some sort of emergency or disaster. This bag is matched with a big tote that is full of medical gear, both for resupplying this bag, but also aiding in setting up some sort of CCP or casualty care station. So let's get into the breakdown of this bag and talk about why I have it set up the way that it is, and hopefully give you guys some ideas on setting up your own bags. All right, guys, let's get into the breakdown of this bag. So this is the Elite Striker medical bag. We got it for about, I think it was around $110, $120 on Black Friday. Normally it's somewhere between $125 and $150. And I actually think this is a very well-made, but also well broken down bag for the price for what it is. And we'll go over that in just a second. But let's talk about the outside of the bag, and then we'll go to the inside of the bag. So starting off, we'll go left to right. In this pouch over here on the side, we have two pieces of diagnostic equipment. So we have a blood pressure cuff, and then we have our glucometer kits. Really, I just kind of keep these on the outside because there are two pouches on each side of this bag, and it just made a whole lot more sense to keep it on the outside where I could easily get to it, but it also is just space that kind of needed to be filled so I could utilize the inside for something else. Everything fits in there quite nicely. It's really not that hard to get stuff in and out. This is a retention tab, so you can tighten things up if you really want to. And then here on the side, we have an Elite Striker tourniquet pouch, and easily comes out a pair of trauma scissors. Switching to the other side, this is actually a Condor pouch, but it holds latex gloves. Right now I have 8 pairs of large black latex gloves in there. I believe you can fit 10, but if you fill it to the max, it's a lot harder to pull them out individually, and you have to start pulling them out in chunks, and you have to repack it. But gloves get filled from the top here, and then this splits open, and you can pull out gloves. We leave this pouch on the side here, this pocket empty. That way, whoever's in charge of carrying this this bag, they can keep their water bottle or some sort of water source in this pocket on the side. That way, our designated carryee always has water. And then this front pouch here, honestly, I really don't have a lot in here. It's not very deep of a pocket. It's very flat, but we have a few small things in here. Really of no certain priority. It has a ton of little retention tabs, but just not a lot fit in here. So we have some space blankets up front, and then we have a Sharpie, a pen, and then a pair of tweezers. Anybody that's ever done anything with wilderness medicine knows that tweezers can come very in handy for different type of environmental injuries. All of the zippers on here are pretty well made, I would say. The stitching looks very good, very consistent. It doesn't look like a cheaply made bag. These are retention tabs here on the front too, although they don't have much stretch to them. So really, I'm not utilizing that to any capacity. When you come up here to this top pouch, we have a tourniquet, 2 pressure bandages, and then underneath this tourniquet, running horizontally, I have another tourniquet here. Now I'm going to open this bag up. I do apologize for the lack of space. This table is only so big, and this bag opens up very nicely. So I'm going to try to keep everything as centered on the camera as I can. So right off the bat, really big and roomy on the interior. It has multiple divider pouches, more retention bands. But I think my favorite thing about this bag so far is the rip-away pouches that it comes with. So these pouches are Velcro, and they have different spots within the bag so you can place them. So normally there's another Velcro pad underneath of here, and this bag would go here, but I find that it comes better over here so I can stack the other things that we need down here at the bottom of the bag. But another thing I like about these pouches is they are color coded. So we have a red pouch, a blue pouch, and then tucked away a yellow pouch. So you can split things up based on category for somewhat of consistency and organization, and it's easier to identify items. So right off the bat, at the top of this, the very first thing you would do if you opened the bag, if it wasn't opened large and flat like this, is one normal trauma IFAK. Tourniquet, pressure bandage, nasal airway, all that good stuff in here. This is just one IFAK. That way I could take this and I can give it to somebody, and someone could effectively do march on a casualty. This is the only complete IFAK in this pouch, although there are other pieces of gear in here. This is the only one solid IFAK in this bag. So while we're on the pouches, we'll just talk about the pouches over here. Our next pouch on here, and all of the pouches are rip away, is our blue pouch. And this is our airway pouch. So in this pouch, we have different size oral airways. We have an adult and infant CPR mask. We have nasal airways in here. We have spare needle Ds in here. We have spare chest seals in here, and anything else we acquire in the future, airway-wise, will probably be fit into this pouch. Now, this pouch is basic skills. There are no advanced items in this bag. What I mean by advanced, I mean high-level EMT or paramedic items in a sense, such as eye gels or tracheal tubes, anything like that, at least speaking on the airway perspective. I know needle Ds are a more advanced piece of equipment, but it's something that's standard with IFAKs, and I personally know how to use them myself. Everybody in the group, I wouldn't necessarily trust to use them because they haven't received proper training, but we have those in here as an option. So this bag is supposed to be set up so everybody in the group, regardless of their level of medical training, should basically be able to use almost anything in this bag. So that is our airway pouch. We'll put this to the side for a moment. Our last pouch here is the boo-boo pouch, which is a yellow pouch. Basically, all of our Band-Aids, 2-inch and 3.5-inch Acrylics are in here. Nose plugs. So story on nose plugs, I keep nose plugs in every medical bag that I ever make. Reason being is the first time I ever did medical coverage for a training event in the Marine Corps, a guy got a nosebleed in the middle of the hike. They sent him to me, and I had all this big gauze wraps and all this kind of stuff, but I didn't have something as simple as nose plugs. And so I was out here trying to cut up gauze and all that kind of stuff and shove it in his nose, which now I always just keep this real cheap pack of nose plugs in my pack. But in here, we have things like athletic tape and, bandage rolls for sprained ankles, wrists, elbows, things like that. We have medical tape, we have gauze, we have all that kind of stuff in here. This is the overall boo-boo pouch. This is where you can go to get just about anything to do the very basic first aid type stuff. Moving down from the pouches, you'll find some folded up SAM splints. I keep 2 SAM splints in here. Ideally, I would like to use environmental resources to create splints, just because there's usually an abundance of it in a field environment. But in the event we don't have the time to or the resources to, we keep a couple of SAM splints in here. I've unrolled them and kind of fold them over on themselves just to give them a nicer fit in here. This next box is our medications box. There's nothing crazy in here. This is all standard over-the-counter medication, but everybody should know how to use this stuff, when to use this kind of stuff. And even if they don't, very first thing in this pouch is a medication chart, which shows the dosage and the size of the medications that are in here, normally in milligrams, how often to give it to what kind of person, all that kind of stuff. So this is more of a reference card for utilizing the medications box. And in here, we have stuff like Tylenol for mild pain management. We have aspirin for cardiac related patients and only cardiac related patients. This is not for pain management. Benadryl for allergic reactions is a temporary option. Obviously, they're going to need epinephrine at some point in time, but Benadryl could hopefully help us for a period of time. We have laxatives, we have anti-diarrhea, and then we have oral glucose. And I'm sure sometime in the future, we will look to expand into more medications. We also have a few standard creams. We have some hydrocortisone cream and some triple antibiotic ointment that kind of goes along with the boo-boo stuff. Again, guys, all super very basic stuff. Everybody should know how to utilize all of this equipment, all of this medication, whatever it may be. And this is just in a standard pencil pouch. Nothing fancy. Pencil box, I should say. Here we have our stethoscope. I like keeping my stethoscope in a nice pouch for protection because it is an expensive piece of equipment. But I also have a pulse ox in here, and then I also have a pen light. That is pretty much the last of my diagnostics equipment. So we have the stethoscope matched with the blood pressure cuff, a pulse ox for heart rates and O2 levels, pen light, and the glucometer kit. Very basic for collecting vitals. That seems to want to give me some trouble there. We'll just go like that. And then down here at the bottom, flat, we have some BurnTech burn dressings, the 5x5s. Only reason they're there is because they don't fit with the smaller ones in any of the pouches. So it was really easy for me to fit right here underneath these pouches. And they're there, they're accessible. With these BurnTech patches, you can cut these up and shape them to how you need them. I like to keep a couple big ones, and I like to keep a couple smaller ones. The thing to realize is if someone has really serious burns, specifically third-degree burns, you're probably not going to be able to carry enough burn dressings or burn gel in your pack to effectively treat them. You're going to need to resort to other methods for treating them in the field, and then look at getting them to higher care with much more resources than you currently have. And the last thing you saw down here was the North American Rescue Pocket BVM. I'm not going to open this up just because it's kind of a pain to get everything back in there, but it does open up and form nicely. This is a Pocket BVM with the mask as well. It also has a O2 tube at the bottom, so you can give supplemental oxygen to your BVM while you're giving respirations, whether that is during CPR or if somebody is going into respiratory arrest. I really like this. This idea came to me from the Prep Medic, which has his own YouTube channel. I very much suggest you guys check him out. But the Pocket BVM is definitely more than enough for supplemental respirations. A lot of people overutilize the bigger adult BVMs to begin with. This smaller one will do the job just fine. Leave this stuff to the side, keep it out of our way for a moment. We'll stick on this side of the pouch. So up here on these retention bands, I have a bottle of calamine lotion. Calamine? Sorry guys, words are hard. And then sterile eye wash. Just some super standard additional ways of treating patients. Over here in this pouch is full of packing gauze, North American Rescue Compact packing gauze. This is only packing gauze in this pouch. I think it's important that I point out that for the pouches that weren't color-coded, I have numbered the pouches. That way it's easier for guys to remember what's in what pouches. But if somebody may have trouble or they're a newer person, I can tell them, go get me this item out of this number pouch. And I expect all of my guys to be able to fully understand and know where everything is in this pouch. In pouch number 4, we have some triangular bandages from North American Rescue. Moving down here, bottom to top, is a little bit more of the boo-boo stuff. We have a lot of extra 4x4s in here, 4x4 gauze pads. We have some 2x2 Burn Tech dressings again. And then one other big item that we have in here is moleskin. I very much encourage everybody to carry moleskin in either their normal packs or their med bags. It has a lot of uses, but specifically, it's very good at aiding the feet, which will become roughed up over time as you complete operations, LARP in your mom's basement, whatever it may be. People's feet get sore. Last pouch here, pouch number 1, I call it the admin pouch. So there is a notepad that is used for kind of the medic or whoever is in charge of this pack, or whoever really, to write down information about a casualty and track information over time. We have a bunch of ZMIS cards with the march steps labeled on the back for writing down patient information and the proper turnover of patients. And then this is the last thing that I got from North American Rescue. This is a casualty reference card, and it has a bunch of different steps on treating casualties or casevac steps, medical operations, all that kind of stuff. Very useful piece of gear for quick reference. If somebody doesn't know something, they can find a lot of the good basics on here. And then even on the back, there are spots for notes that you can put on here. And then the last thing we have in this pouch are some extra Sharpies and pens, in addition to the ones in the front. That is everything in the pack, guys. So there are small boo-boo stuff, there is trauma stuff, we have very basic medications, burn gels, ways to do CPR, take vitals, all that kind of stuff. A very multi-purpose bag, and it's not very heavy at all. It's the size of a normal school backpack, maybe just a little taller, but not much wider. And like I said earlier, all of this gear is going to also continue to build over time in our spare tub. So you can easily replenish this gear so long as you have access to the other tub. Definitely creating some sort of professional and organized med bag will not only increase your capabilities as some sort of response force, but also build relations within the communities, first responders in that community, and whoever else may be having an opinion on you or judging your performance. If you look professional, guys, you act professional, you will be referred to as professional. So hopefully this kind of stuff helps, guys. The Elite Striker bag, I will put a link to it in the comments below. As always, guys, train hard, train often.